Good evening and thanks for joining us. We heard from the Prime Minister yesterday the second wave has already started in parts of this country, and we've reported for weeks on how daily case numbers are on the rise. Now hospitals too are starting to fill up with patients who are seriously ill with COVID-19. Let's start first with the daily case counts. Quebec is reporting almost 600 new cases today for the second time in a week. In Ontario, 409 more people tested positive. Out west, there are 158 new cases in Alberta and 148 in BC. And though hospitalizations are nowhere near where they were in the spring, over the last few weeks in BC, Alberta, Ontario, and Quebec, numbers have started to rise. In Quebec today, 184 people with COVID-19 are in the hospital. That's nearly doubled since the start of the month. In Ontario, the number of patients in hospital doubled from 44 to 88 in the span of 1 week. Hospitals are now sounding the alarm. And in Ontario, where there are long lineups for COVID-19 tests, the government is scrambling to meet the demand, despite knowing a second wave was likely in the fall. Premier Doug Ford promised today to invest $1 billion to expand testing and contact tracing. Ford used to say everyone who wants a test should get a test. Now that's changing. Eric Sorensen explains the new criteria and how it's led to more confusion.
The long lineups, a sober symbol of the state of COVID-19. The virus is making a comeback, and Canada's biggest province has been caught without sufficient testing capacity.
We were at St. Mike's yesterday and we waited for 3 hours and the lineup didn't move whatsoever.
Ontario has now pledged to put $1 billion into testing and contact tracing, but first an urgent new protocol, no longer suggesting anyone get tested anytime.
We know that over the summer when we opened up testing to anybody who wanted it, we did not find cases. So right now we need to focus on people who are symptomatic.
Current assessment centres will now be for those who have symptoms or have had contact with known COVID cases or where outbreaks have occurred. New testing centres, initially at more than 50 Ontario pharmacies, will start Friday and by appointment for people with no symptoms but who are workers, visitors, or others in high-risk settings such as long-term care facilities. And people with no symptoms and no clear risk factors should not be going for tests at all. Infectious disease experts say the system wasn't prepared for a COVID resurgence.
When we opened up the floodgates and said, everybody come and get tested for whatever reason. But as soon as that surge came, we had no give. And then you start seeing all these lineups at the places people can't get tests.
The province plans to expand testing and is looking at other options, such as saliva tests now being used in BC. But as the number of COVID-19 cases rises sharply, more than 36 doctors have issued a call to reimpose restrictions on non-essential businesses, nightclubs, restaurants, gyms, even places of worship.
And we really need to protect everyone around us by stopping these types of socializing congregate settings.
That is not something the Ontario government is prepared to do, yet.
We're doing all these measures to make sure we can keep the economy moving forward. We aren't at that point right now. But again, everything's on the table.
Unfortunately, it is pretty difficult to normalize your economy without first tackling COVID-19.
A second wave was always anticipated, but it has surged quickly, and autumn has barely begun. Eric Sorensen, Global News, Toronto.